Thank you for letting me have some fun with you guys, but we're going to get our presentation started because it looks like everybody's here and ready to go, okay? So, like I mentioned to a few people earlier, my name is Fran, for those of you who don't know. I've been a hygienist for 35 years. I started practicing holistic dentistry back in 1984. Fast forward, I've been fortunate enough to be able to work with Dr. Gashinsky for the past few years. I'm a hygienist, I also am a public speaker, and I work with a lot of holistic biological organizations. And I'm very honored and humbled to be able to be here today to introduce two fabulous speakers. That will be Dr. G and Debra. We're going to talk a little bit about why we're here. Everybody's here is interested about allergies, okay? For whatever reasons, whether it be themselves or a loved one who suffers with allergies. And what happens is about 50 million Americans a year have problems with allergies, whether it be food, environmental, so many things that they are spending $16 billion to try to help themselves. So buying chemicals to help prevent your nose from running, your eyes from itching, and your skin from swelling is really, quite extraordinary. But what if there was a way that you can eliminate the problem? What did we talk about before? Finding the root cause. Being able to address the root cause of the problem, and that way you don't need to buy that medication. Wouldn't that be great? I think that would be pretty awesome, okay? So that's why we have our speakers here today. They're going to talk to you about some of the things that they see every day and how you can address it, so that way you don't have to be part of that statistics, because it is the 6th leading cause of chronic illness in the United States. So we have a way of actually changing that today. So first of all, what I'm going to do is I'm going to introduce you to Dr. G. Dr. Gashinsky, as I said before, we lovingly call him Dr. G. He has been practicing about, 40 years and about 20 years here, yeah. So he's pretty learned and, he's okay. We'll keep him. Yeah, he's pretty good guy. So he's been practicing privately here in Millburn for at least 10 to 20 years. For 20 years, and then he's been providing exceptional holistic care, biological care. He was practicing conventionally, and he had a good fortune of meeting other holistic practitioners who kind of changed his mindset. One day you can ask him those questions. He'll be happy to share that with you. He went to NYU. He was able to get his licensure here in NYU, and they loved him so much they asked him to stay on the faculty. He was actually the faculty leader for a 4-year period training graduate students in restorative care. So, excuse me? NYU Dental, that's right. So he was teaching there for about 4 years. And now he has actually become also not only a DDS, and he's accredited by the International Academy of Oral Medicine and Toxicology. He's SMART certified, like we talked about earlier. He also is a naturopathic doctor. So he has added that to his armamentarium, because that way he can not just treat your teeth, he sees how your mouth is connected to your body, and he's able to help you as a whole. That's what the meaning of holistic is, right? So basically, he follows stringent protocols set forth by IAUMT, and not only that, he literally just came back from Switzerland a week ago. He was there for an exclusive seminar that he was especially invited to on zirconia implants, and he came home with a lot of great, incredible information to be able to help his patients more. So on that note, I want to welcome Dr. Gashinsky. Please, let's all welcome him. He is also the president of the Holistic Chamber of Commerce, the first one in the state of New Jersey. And then the practitioner here, we have our meeting on Tuesday. Why don't you have a seat, Dr. G?
And they're keeping me only because I can fix the stuff. They mean I cannot.
You're very handy to have around, Dr. G, I must say. Okay. All right, and next we have somebody who's amazing. Some of you know who she is, Debra. She has been a nurse since 1974. That's when she first started her professional career. So Debra Nicolosi, she dedicates herself more now to a holistic approach for allergies by using a bioenergetic intolerance elimination, or BIE. Remember the remember the abbreviation? Because it's much easier for me to say it at that point. So BIE, because allergies can manifest in a wide variety of symptoms. And I'm just going to read you her bio because it's very interesting. So basically, in 2001, Debra started having an experience, an allergic reaction to processed wheat products. Who doesn't here in the United States, right? Everybody's gluten sensitive. Around the time of this life-changing event, she became involved with the Westie Rescue Group. It wasn't long before one particular dog she found became part of her family. Shortly thereafter, the dog appeared to have had developed some allergies. Months later, through this rescue group, Debra learned about the BIE. So the BIE was able to help her Westie. So with BIE, Debbie found that Daisy could be helped and that Debbie could have her allergy eliminated as well. So after a few appointments, she found that she was now cured, or she had a tolerance now for wheat. So here we have, again, go back to the conventional allopathic, now her mindset was changed. So now she's sharing what she has learned with all of her patients, or all her clients. She's helping them get healthy. And we want to thank Debra for being here. So Debra Nicolosi, please come on in. We are very excited to have you here to share all your knowledge on how to eliminate allergies. So, wonderful. So, well, thank you for coming, and I appreciate you being here. All right. So, what we're going to do is we're going to just do a little bit of a panel, a few questions. I'm sorry, Dr. G, my hand is going around.
I get used to it.
I should tie my hands behind my back, and I won't be able to have a conversation then. So, but what we're going to do is we're going to have Q&A afterwards. So when we're all done, everybody's going to go downstairs, and everybody's going to have their own room, and then you can ask specific questions to the practitioners and any of the staff. All right. So we're going to reserve any questions till the end. Okay. So we're going to get started, and I'm going to ask Debra, what are the most common allergens that you see that clients are coming to you for?
Well, right now, because we're in the middle of May in New Jersey, we're having that pollen tsunami, and everybody knows when you go out to your car in the morning, it's covered with something green or yellow. So the pollen right now from the trees is monumental, and then we're going to be segueing right into grasses without a blip on the screen in between, and also the flowers, because everybody around here loves the spring, they love the flowers, and there you go, all that pollen, and we're just adding to it along with all these trees that we have. So pollen is tops right now. Food is year-round. There are weeds in the fall, because everybody hears about ragweed and all of the issues that you see people with the swollen eyes and the runny noses starting the end of August through September, pretty much till frost sometimes. And then throughout the winter we close up our houses and turn the heat on, and then all the dust comes blowing up through the vents, and people who are reacting to dust are now having some issues themselves. And then we've got the animal dander and pollen that people tend to be sensitive to, and then environmental, all the diesel fumes, gas fumes, and it's just a big pot of soup.
Now, when you say symptoms, like what exactly are, like what are they coming to you with? Like, what are their complaints?
People come with digestive upset, especially if it's food related, breathing issues. They come with runny noses. They come with swollen eyes, swollen almost shut, some people. Ears, itchy ears, and skin rashes. And sometimes when there are some allergens that are reactive, like eczema, when somebody eats or comes in contact with something, like usually it's children, they will react with a rash on their skin.
Yeah, that's why I was going to ask you, because a lot of us know the general symptoms of allergies, but is there something that maybe somebody wouldn't recognize? Like if they have a symptom, but they oh, that's not an allergy. So.
Very often, somebody who has diarrhea or a bowel upset, that can be a reaction to a food or to another allergen.
Yeah, because sometimes we don't always recognize that it's an allergen, an allergic reaction to something. We think it's something else, and we run into our you know, a
Right.
doctor saying, I, you know, give me
Yeah.
something for my, you know.
Yeah, for my diarrhea.
Right.
You would think it was an allergic reaction. Yeah, so you can, there's a whole host. Toenail fungus. Most women who go to the nail salons and they have the toenail fungus aren't even realizing that that all goes back down to digestion and immune system, which is another big piece of allergic reaction.
So it's important, it's not just the runny nose and
Skin
the
reactions.
UTIs.
Yes,
It's a big deal, you know.
skin reactions are huge.
Exactly.
Yeah.
And Dr. G, what do you see in like your patient has allergic reactions?
You know that unfortunately in my field this is no seasonal allergy. Nothing really changed here because it's a constant allergic reaction. Patient can. This is metal allergic reaction. You know that statistically we know that 60%, 6 out of 10 women in the United States are allergic to nickel, and in reality only half of them know about it. And they ask everybody what kind of earrings you can wear. Can you wear costume? Can you wear silver? Can you wear gold? What you feel comfortable, not comfortable? And they look at me, and after they realize the reason why I'm asking for this, I see the red gums around the crowns. I see inflamed gums in teenager, and they wear braces. It's a lot. It just happens a lot. And it's interesting to me because I basically eliminated braces from my practice 20 years ago. And I don't do any more metals in my practice, but I see teenagers coming from orthodontal practice, and I see a lot of irritation. And the minute that brace is removed, the gum just healing by itself. And you know, it's allergic reaction. You know that nickel titanium, unfortunately, is not the best combination. Whatever I know, and that's why in our practice we just avoid any metals. Also, the main thing is a combination of the metals. You know, because every metal have a different electrical potential. You know, if you have a gold crown, titanium implant, silver fields, it's a mixture of metals, and the electron just flying around along your mouth like a battery effect. It just creates a
Really
much,
has a battery
much
effect.
better. Yeah. All right. This is the main thing. And also look at the patient time. You know, that they see that there's just a problem right away.
So it's like all tied in, so you're
Everything
seeing,
tied in.
you're seeing symptoms in the mouth
Yes.
of allergies, so it's
Yeah.
not just the runny nose and the itchy eyes,
Yes.
so
Yes.
it's amazing how that can happen. Now, as we were talking about digestion, we know
Yeah.
that digestion starts in the mouth, and so that you see, you know, symptoms of that.
You see a lot of problems.
And from what I understand, if there's leaky gut, there can be a higher incidence of food allergies. And then, is this something that you see?
I see that every day in my practice. It is so rampant because of all of the things that we are introducing, the processed foods, the medications, all the environmental toxins that we are just absorbing, even on our skin. As soon as something hits your skin, in about 20 seconds, it's in your bloodstream. So when you go out there and you go to CVS and you get a lotion for yourself or your children, you want to read those ingredients. You want to be careful what you're putting on your skin, because that also will affect even your digestion or your breathing. And so it's really important. But back to leaky gut, that is a huge thing. We have neurotransmitters that transmit all kinds of information. Most people think of it, when they think of neurotransmitters, they think of the substance called serotonin. Because a lot of people are on antidepressants and you think about serotonin being with the brain. But we actually produce more serotonin in our gut than we do in our brain. And people aren't even aware of that. And why should you be? Because when you think of neuro stuff, you think brain. But our brain, our gut is actually called our second brain. And so many people are so affected. I mean, if something happens to you and it's like you're in an accident or something, most people, they feel it like your gut just seizes right up. That is, you know, that's sending signals through your whole body. So being, you know, aware of what we're actually putting in our mouth that is going to get processed through our stomach is so important. Eating clean is vital. Trying to stay away from the canned food, the processed foods. eating organic is just so important, because otherwise you're eating all kinds of chemicals that they spray those plants with from the time they put them in the ground as seeds until they harvest them. And then it's, you're absorbing all that, and it's going through your whole body. So it's important to be really aware of what you're eating, be aware of what you're putting on your skin, and what you're exposing yourself and your family to.
About putting on the skin, it was just recently on the internet that Hawaii put restriction of amount of sunscreen you can put on your skin because they want to protect environment in the ocean, not protect human beings, protect environment in the ocean, because it's bringing the coral reef.
It's killing the coral reef. Can you imagine what it's doing to you?
What it's doing to you. It's interesting because you know that many years ago we went in one of the parks in Mexico, and you cannot use sunscreen there. And you can use only one clean brand sunscreen from I forgot from another country, which is very clean and everything else. Otherwise, you cannot use a sunscreen because it's bad to environment.
It's amazing how you know one thing. It's like one. This is connected to this. It's connected to this, and you wouldn't think.
Yeah.
All right. So if somebody has an allergic reaction, I'm going to my allergist. He's going to give me flu shot, allergy shots, or tell me to take a certain medication. But actually, it could be stemming from another issue.
All these other sources.
Yeah.
Right. So people will not realize. So again, it's about getting to the root cause of why you have the allergic reactions, or why you're having these sensitivities. That's what it sounds like you're saying.
Yeah.
I must share my own personal experience. You know, that 15 years ago I was diagnosed with eczema. I have nothing. And you know that, and I did not accept this diagnosis because I went to a top-notch doctor about another. And I told him, this is cream in the morning, it's cream at night. And how long? I told him, forever. I thought, thank you. Went for research. And finally I found the doctor who did the test for me, food allergy, and I found out I'm allergic to two things, cranberry and celery.
Wow. Cranberry and celery.
I developed allergy to those products because in reality, in Russia we don't have too much celery, and here I trying to control my appetite at night, and I eating celery sticks. And second, that I fell in love with this, cranberry, because cranberry in Russia are real sour. It's a real stuff because it's a wild one. Here we have a sweet one. I'm coming in and thinking, basically I developed allergy to myself. Can I live without celery? Sure. Can I live without cranberry? Sure. If I go to Italian place, I order everything without red sauce, because I know they put the celery in. And I really have no eczema anymore. And it was so easy.
And it was, again, they wanted to give him a prescription, they want to give him a cream, they want to give him junk, right? Instead of just getting to the root cause. Okay. I'm going to beat this horse till it's pulverized, okay? I'm beating a dead horse, that's all. Because it's, this is why stuff excites me terribly. All right. Now, with the food allergies and leaky gut, from what I understand, also Canada can be involved with that, with the condom. Oh, go ahead.
Candida is huge. Most people, I think at least 85% of people who have allergies, not just food allergies, but any kind of allergies, probably have Candida overgrowth. We're all supposed to have a little bit of yeast in our gut, but there are certain prescriptions like antibiotics, steroids, and that doesn't mean if you got them this month or last month or 2 months ago. That means if you've ever had them. And also steroids, which any kind of sprain, injury, most of us have gotten steroids for, or even people with asthma. You get what do? They give you steroids. And other illnesses, you get steroids. And then that will cause the Candida to start overgrowing, and it just can take off and cause all kinds of problems. And it is a great imitator. You think you think you have something, and you get all these issues, and every day, and I mean every day, multiple times a day, people coming in my office and telling me that they have all of these symptoms that are totally unrelated. And when they start listing off their symptoms, like headache, some congestion, if they're having digestive upset, if they're having a lot of burping, or if they're having acid reflux, if they've got fungus on their toenails or fingernails, if they're having some skin rashes, and then there's some other more obscure symptoms that just with hair issues and all kinds of things, that when they start telling me all these things, they're like, this is so crazy, and all these things are wrong with me, and I don't know what's going on, and the doctor has no idea, and it's all pointing right to Candida. And so when I'll test them, I do muscle testing. I don't do blood work in my office. We do muscle testing, so there's no needles in my office, and which especially children are thrilled to hear. And most people are pretty happy. So dandruff would be a huge indicator. And even in pets, when I've had people say, my dog has dandruff, and I'm like, yeah, there's a type of Candida that actually animals get too, and that's another story. But anyway, but dandruff is a big, yes, a big thing with Candida. And then, so when people come in, and most people who come in my office have Candida overgrowth, I put them on a cleanse, and we give them a couple supplements to kill the Candida and kind of replace some good bacteria in their gut. And I have some other things, some other protocols I use, and within a month, most people are free from Candida overgrowth. Headaches are a huge indicator for Candida overgrowth, and people are on tons of medication for that.
And from what I understand also with Candida, and there's a link with mercury toxicity?
There is. When people, and since a high percentage of people have Candida overgrowth, it's actually now called the American parasite. And Candida overgrowth in your body will actually make you hold toxic levels of mercury in your system. And that's something that Dr. G is working diligently to help people get rid of. And that we also do that in my office, where we will actually, I have some protocols I use that will actually cause your body to expel the Candida rapidly. I mean, not Candida, but also mercury rapidly.
So, yeah, go ahead.
What is Candida?
Candida is heat.
Oh, no.
I'm sorry.
I'm a layperson, so
Okay, I'm happy to tell you.
It's yeast infection.
It's yeast.
Candida?
We're all supposed to have a little bit of yeast in our gut, but if we've been stressed, it makes it just start overgrowing. All antibiotics, steroids, birth control pills, and a few other prescriptions will actually make it start overgrowing. Do you ever make homemade bread? You put a little bit of yeast in a bowl, you put a little sugar, you put a little warm water, and something that big grows into something gigantic. And that's what's happening in our body. You get bloating. If some people after they eat, they get very bloated. That's a huge indicator that Candida is too much in your body.
It's like a fungus.
Two questions. Suppose you had none of those symptoms. Suppose you never experienced any of those symptoms.
Yeah.
Maybe
Then
you're
how-
lucky 15%.
I'm sorry.
Maybe you're lucky 15%.
Let me just listen to you. I have.
Good.
No, that's perfect.
That's
So
wonderful.
that means you don't have that.
It might mean that you don't have it, but
Exactly.
I use energetic vials to muscle test people with, and I have one vial very specific for Candida. I had them make it for me, and it has 13 different strains of Candida, from the very common ones to some very obscure ones. And if you've got Candida overgrowth, I can tell.
So basically back to with the mercury,
Yes.
with the mercury toxin, it sounds like, it's almost like a hand-in-hand thing.
Yeah, mercury make it much worse.
But the thing is that as you're removing, she's helping, if the
We
patient
can
has
help your
Candida.
body eliminate it.
Right, because if you put them on a detox protocol, and if they have
Yes.
Candida, then,
Yeah, the problem.
this makes a lot of sense.
Because that what Debra said, that about the Candida overgrowth and everything else, it's a better affect your body. But in reality, mercury just working the hands to hands, and that mercury changes everything inside of your body. It's all these enzymes not working properly, don't attach properly, and that's why people are feeling the great relief after we remove solar films. Every time that we finish with the patient, they're asking for the testimonials. Tell us, how do you feel? And this is most important thing. They feel different. And they feel different. And I have so many patients come in and tell you, I've been here to the doctor, they removed silver field, and I feel sick. Sure, you feel sick. Because nobody went for precautions with you. Nobody taught you how to preserve yourself. Basically, you're sitting here in the mouse and you're just drilling and you're inhaling the mercury into your lungs, into your brain, all over your body. You know, you're just poisoning yourself. You know, it needs to be done right. And after the mercury removed, we just plow the road for Debra and she can clean everything up. This is true, because I plow the road for the other practitioners. I have to make sure that they can get anywhere, because this is the stay, put in the barriers.
Yes, yes, it's a huge barrier.
Put in the barriers.
And so, yeah, we want to, not only do we want to get rid of it from like your teeth and from your tissues, but we want your body to expel it and be totally gone with it.
That's why I mentioned before, for the people that were here a little earlier, we were talking about mercury, and you have some people that can metabolize and get rid of it, and others that can't. That's what non-excretors, right? So it stays in their body.
Yeah.
And so, you know, and if we don't know if the patient is candidate or not, we can put them on a detox, and maybe they're not getting the results. So it's great to know that you can have that ability to do that.
That's, yeah, it's vital for people in this country.
I also heard that Candida with Lyme disease now, because Lyme is becoming.
Oh, that's huge. Candida and Lyme have pretty much the same symptoms, the foggy thinking, all of the other things, and also Epstein-Barr virus is a big piece of that. Almost everybody has Epstein-Barr virus of some level, which is another word for mono.
So,
It's very connected to Candida and Lyme.
And Lyme, if you're not going to remove the infection from your teeth, from the jaw, from everything else, you're not going to have too much results. Because it's, I just came from the Switzerland and they talk about the Lyme disease surgical intervention inside of your jaw, the removal infections. You know, that they said they have a 70 to 80% improvement after removing infected tissue from the jaw. 70 to 80%. You know, no medical doctors can give you as much fast result as a dentist done properly.
and who would think your teeth were attached to your body?
You know, this is a silly idea.
It's true. Well, I'm sorry. For my generation, it was a total disconnect. You know, here's my teeth, here's my body. There was no correlation. All right, so you know, so this is
But
great
somehow
information.
then somebody has a toothache, they
Yeah,
cannot
well,
function.
yeah, no, it's, that's very true. I think we've all been there at some point. All right, so Dr. G, not only mercury is an issue, many dental materials can cause an allergic reaction, which we talked about a little bit before.
Yeah.
Also, when extractions are done and the site is not completely cleaned out, some of that tissue that's left behind can cause a toxic, environment. So,
You know that, I don't know what to tell you, because most of you who've been here dental patients or planning to be dental patients, we're going to check everything, you know. And in my mind, you have to clean it up. You know that they said they plow the road, it means that you need to clean it. You know, whatever you have in your mouth, if you have a silver restoration, and usually in 5 years after the silver filling stay in your mouth, it's decay, it's a guarantee. It's not my word, it's, that on an old dental book. And you know that the multiple metal, it's a big no-no to put in according to the state of art, dentistry, you cannot put it. And this is a problem. And we're removing the tooth, infected tooth, we have to clean infection. And whatever we're doing, and Dr. Vitlani talked to you about it, putting a bone graft made from your own blood. And this is basically almost no contraindication unless a person really sick. You know that sometimes you draw in the blood, you get nothing from this blood, a real good one. But it happens very, very rare because most of the patients coming here, they're really trying to take supplements, they're trying to eat well. And this is then the cleaning up, it's to make everybody feel better. You know that maybe a few patients sit here, we may ask them, just how they feel after removing infected tooth, and everybody going to tell they feel much different. And I want to tell you one thing, that in addition to this one, dental material might be allergic to, and if patient has any allergic reaction, a lot of allergic reaction, we ask them to do the biocompatibility testing. The Dr. Sunny talked to you about it, and we can draw the blood and we just run it. Patient who basically healthy, the 99% sure that that good material is going to be working for you very well. But if somebody is really sick and has a lot of problems medical, we really recommend the test. In addition to that, I can see just looking in the tongue if you have a digestion problem. It's just so easy for me. I'm not going to be your physician because I'm too occupied in what I do the best, and in reality I'm not going to plan to just heal your digestive system because it takes much more time and energy, because as a naturopathic doctor I'm just baby. I just become naturopathic doctor a year ago, and still in process of learning, but I look at your tongue, I can tell you right away we have digestive issue now. Is the kidney functioning well or liver functioning well or not? That I cannot tell you exactly what the problem is, but I can see it right away. And we have a remedy that we're using to just start flushing toxin in your body to prepare for everything that we're doing here. Also, we have a great practitioner like Debra I can refer you to. Every time you come in the office, you have all this place that there are tons of cards posted there for any practitioner, any area that you're looking for.
And then you were saying that Deborah can help you now.
Yes.
What I need to know, we talked about the BIE.
Yes.
What is BIE? Let's get to the crux of it. Like,
Okay.
what is it?
What is it? BIE stands for bioenergetics, and actually what it does is I use the vibrational, I have little vials I have thousands of them. And someone actually gave me a sign a few years ago that says, I have a vial for that. Because whenever anybody says something to me, my response is usually, I have a vial for that. Because I have collected over the last 12 years, thousands of vials from very common things like dairy, sugar, milk, gluten, things like that, to some very unusual things. And so, so when I muscle test you and I determine what's going on with you, I have a little machine, and we call it the BIE machine.
Can I ask, what is muscle testing?
Oh, okay, I'm sorry. I'm sorry.
No, I mean, I know what it is, but I want to make sure.
Okay,
Yeah.
what I do with muscle testing is, I have multiple ways of doing it. For people who come in the first time, there's a very simple method. Because everything gives off a vibrational frequency and it kind of travels out from the space like the little vials. I'll hold it on someone's shoulders, I'll press on their arm. It's a very simple thing. If it's something that resonates with your body, it'll actually make that muscle stronger. I can't budge your arm. And if it's something that you have an issue with, your arm is like a wet noodle. And it doesn't matter, I'm little. It doesn't matter how big you are. I have guys who come in who can hardly come through the door, and their arms go down like a rock. And so it's a very basic way of testing, but it's very effective, and more doctors are actually seeing the benefit of it. I was just at a conference last week with a whole room full of doctors, and they were all talking about muscle testing. So I'm very happy to have it as my tool. My clients are very happy because we don't do blood work. And so that is muscle testing.
Yeah, I didn't mean to interrupt you there.
No,
So
that's okay.
You're using the muscle testing.
I use muscle
to
testing
see the allergen, and then
to see what you're reacting to, and we'll pick out the major things. We start with picking out the major things, and I tell it it's like peeling an onion. We'll pick out the major things, and that layer's gone. And because usually within 1 to 4 sessions of doing a BIE session, you're done with whatever, and it's usually forever. So BIE it's a little machine that I use, and we have people sit in the comfy chair. And did you talk about Meridians? When you talked about Meridians?
yeah, downstairs.
Okay. Well, in my practice, I tell people that Meridians are energy channels, and they run through our whole body. and they're transmitting information. And so, so when a meridian it gets obstructed, then you start having issues. And so if I put, like say, the gluten, I put that on the BIE machine, and I have you hold one rod that connects you to the machine, and with another rod, I'm going to touch different specific meridian points. Whatever I have sitting on top of this little machine I have, that introduces that frequency to your body, causes your body to start dumping toxins, and then when those toxins are gone from your body, you're going to stop overreacting to like whatever your strawberries, dairy, gluten, whatever. The lady who worked on me when I developed the horrible gluten intolerance worked on me one time. In 1 week, I was eating Leaky.
It almost sounds like a reboot.
I've actually started telling people that within the last month that I'm rebooting them.
It sounds like a total reboot. Like when you reboot your computer, do a hard reset.
Yeah.
That's what it sounds like.
It is.
Very cool.
It's energetically. It's an energetic reboot.
Wow.
You have the same thing here because every tooth connected to meridian.
Yes.
You know that I have so many patients that they remove specific tooth, but my kids can move because it was interference. And this is a big thing because every tooth connected to a specific meridian. And you know, usually 2 teeth connected to 1 meridian and some teeth connected to 2. And this is very interesting because our human body designed in a very interesting way. You know, the teeth have multiple thousands of contacts. They created electrical impulses and energy flow. That's why, you know, that Mother Nature, God, whatever you want to call it, designed us this way. That's why, you know, that all teeth connected to all meridians. And it's very, very important to us to have a healthy mouth, everything else. And that's why I want you to have no empty space. I want to put an implant. Because implant, ceramic implant, I make electrical flow back. Okay? Because we're working basically on the same system from different operations.
Okay, so they're both using the meridians, and you know, she talks about meridians a little bit. Meridians are energy pathways, and actually they were proven. There was a Korean study in 2013 that proved beyond a shadow of a doubt that meridians exist, because a lot of times, well, you can't see it, you can't take a picture of it, you know, it's not real, but you know, people who have had acupuncture or acupressure, people who do EFT, you know, tapping, all that, know that, you know, it works, you know, Reiki and all that stuff. So that being said is, you know, using these modalities, you know, sorry to hog it's mind-blowing that how you can just totally reset your system, because, you know, if you don't have allergies, you know somebody who has allergies. My son has a couple of anaphylactic allergies, so, you know, my ears are really perking up here. You know?
I've had many children come in. Peanut allergies are
huge.
And nut allergies. And I have many children who come in with peanut allergies, and I tell the parents, this isn't so you can give your child a peanut butter sandwich. This is so, because they usually come in when they're like 4 or 5 years old, after they've been diagnosed by a doctor with anaphylaxis. But, so the parents have a lot of control over what the child eats. But once they get to be 15, 17, 21, and I tell them, this is like an insurance policy. So when your child, when he's 17, kisses a girl who just ate a Snickers bar, he's not going to end up in the ER. And so, and we've all heard on the news, terrible consequences from people with anaphylactic reactions.
So basically the anaphylaxis, yeah, we're gonna hold all questions to the very end. You'd be more than happy to answer any questions and down in the rooms downstairs. So, you know, pretty soon we're gonna start wrapping up, but just hold that thought, okay? So basically you're not saying that you necessarily eliminate anaphylactic reactions.
I would never say that,
minimize,
but
okay.
we can
Just wanna make sure
minimize it
everybody's clear.
so that they can,
If they had an
yes, to the
accidental
help
infection
they
or-
need. If they accidentally came in touch with it, it would reduce, it has the potential to reduce the reaction.
Okay, that just want to make sure everybody was clear on that, so. And you just talked about gluten and dairy and this, you know, we know that it creates a lot of systemic inflammation and all that.
Yes, it does.
Does the BIE help with that?
Yes, it helps tremendously with that, because if you get your body to neutralize and stop overreacting to something, if if your reaction is inflammation, and we pull that piece out of the puzzle, when you come in contact with that item, you're not going to have the inflammation. It just is not going to happen anymore.
So you see a lot of your clients resolving nicely from this treatment, I imagine.
Oh yeah, we have a lot of people who say they've been seeking treatment for whatever their issue is for years, and then they come in and we very quickly narrow it down to what it is and deal with it, and then they just stop reacting. And I just want to say something about what Dr. G does and what I do. And that is, whatever we do to help you, it's going to cause your body to react in a very positive way. And so every time your body starts dumping toxins, like from the mercury or the other chemicals, or from the allergens or whatever I work with, it brings your immune system up. And if your immune system starts coming up, you're not going to get sick anymore. And and if you do have infections, your body's going to be able to overtake them instead of the other way around.
Absolutely. And what's more holistic than that, like I said before. So, basically we're gonna probably wrap that up, and I know you probably see some issues, you see with the tongue diagnosis, with the gut issues, with the gluten and all that, so, okay. So there you have it. You don't really need to suffer anymore and spend hundreds and thousands of dollars on allergy shots and medications and Claritin and, I shouldn't say that, antihistamines and all that stuff. You have a way, you can eliminate the cause. Here we have two modalities that actually work in tandem, and they work separately also. How we can eliminate the root cause of your allergic reactions or sensitivities and things that you didn't think were allergies. Now you realize, well, maybe that symptom is not, it's an allergy or a sensitivity. So we have ways to address that. This is, again, a true definition of being holistic, is finding the root cause and eliminating the cause.
If you eliminate the root, then whatever's coming up from that root, you don't have to deal with it.
Exactly.
It just go away on its own.
Same thing with you, right?
Yeah.
Eliminating
it.
Eliminating the mercury, eliminating the bacteria, the parasites, getting to that root cause.
Body heals.
Exactly.
And you need just to give it a little bit supplements, a little bit vitamins, proper nutrition, air, in order to take care of electromagnetic field.
Exactly. So it's about getting you healthy. Our promise to you is our promise to you is to be able to do no harm. We want to be able to empower you and get you healthy and keep you healthy so that you don't need us in the future. Okay. We love to see you, but we don't want to treat you. We want to do things for you, not to you, okay? So that being said, I've been very thankful and grateful that you all took your Saturday afternoon to be with us today. I want to thank tremendously Debra and Dr. G to giving us their time to speak to you today. And again, we want you to be healthy, live long, and we're going to answer some questions downstairs. And I personally want to thank you because you put up with my silliness earlier, and I really, really, truly appreciate that. So what I'm going to do now is I'm going to ask Dr. G and Debra to go downstairs and go to your room. Go to their rooms. So this way that they're going to be available for questions. So they're going to